Thanks, Rennie, and thanks everyone for joining today. Apologies if I sound a little bit congested. It's coming down pretty hard in New York right now, so any East Coast audience members can probably empathize. But let's get into the presentation. So there's a lot to talk about, but unfortunately not an infinite amount of time. So here's what we're going to be talking about specifically. I'll start by talking about some of the macro level changes in healthcare that's pushing this consumerization, and then I'll go into how primary care is changing and being unbundled. That will take us through home diagnostics, retail clinics, urgent care, direct primary care, telemedicine, and prescription management. I'll wrap everything up by looking a bit more forward and seeing how AI can and is already shaping things. Healthcare consumerization can be a pretty vague term, so I want to define it more concretely as the first line between a patient and the health system, understanding how patients directly get healthcare goods and services. So we won't really be talking too much about the back office, biotech, or a lot of other shifts happening in healthcare, but we do have a lot of research on that as well if you check out our research page. Now, let's begin with the macro level trends, which include a lot of statistics you've probably heard a ton, so I might breeze through them relatively quickly, but I think they're a good foundation for the rest of the story. $3 trillion is the magic number that's been thrown around. We passed that amount in healthcare expenditure this year in the US, and it's more than 17% of GDP. We're trying to find regulatory changes to reduce this expenditure, but unfortunately a lot of healthcare is in regulatory flux. We're seeing clear steps in specific niches and areas to move to preventive health in the form of reimbursement schemas and more competitive environments, but there's still a long way to go. The problem is that healthcare expenditure keeps going up during this time. For a family of four, the average annual cost is nearly $27,000. And that price increase is going faster than inflation is. Compared to the baseline inflation of 55%, healthcare was nearly double, as consumers were feeling the costs more acutely each year. A large part in the price spikes have been in prescription drugs. You've probably seen some headlines about sudden price increases for orphan drugs like Daraprim or life-saving staples like EpiPens. We're most likely going to see this debate get worse as we enter an era of curative therapies like Kymriah and recently Luxturna priced above $800,000. So that's definitely going to be a dip in the rainy day fund. So it's clear costs are going up. One of the ways that governments and payers hoped costs might come down is by making consumers better shoppers of their own healthcare. To do that, they push people into more high-deductible health plans. This is one of the big drivers in healthcare consumerization. Combine that with the fact that healthcare is still one of the least digitized sectors, which you can see from this McKinsey study, and new companies see this as a ripe opportunity to build consumer-facing tech tools, since most of the tech in healthcare has been focused on billing, which probably won't shock anyone listening who works in healthcare. This is where new interfaces for the healthcare system become so important. Right now, people are more comfortable buying a car or a house than navigating the health system. And most of the problems have to do with coordinating the different parts of care and figuring out how much they need to pay. Organizing this complex system is one way tech can be a major asset, especially since a lot of the growing costs come from the fact that companies hide behind this opacity. Another area tech tools can play a huge role is managing chronic disease, which are largely lifestyle-based and are a massive chunk of total healthcare expenditure. Now these diseases can be monitored and addressed properly outside of the hospital thanks to the proliferation of mobile phones, and more startups are leveraging this fact in all different areas from mental health to pediatrics. So given everything I've talked about, it's no wonder that digital health is starting to see more traction. Here we used our Trends tool, which monitors media chatter, and the area has only seen more attention in recent years. And the dollars have been flowing into digital health startups has grown in tandem. This last year already broke previous highs with more than $6 billion invested. And it's not just startups. We're seeing more big tech companies invest or start their own health divisions. This is our social graph, which tracks corporate investing in private markets, and almost every large tech giant has a healthcare play, and many of them have started getting more serious. And so those stats hopefully set the stage for how the interface of healthcare is changing and becoming more of a consumer product. Primary care has traditionally been a patient's gateway into the health system, but the issue has been that a lot of people lack access to primary care physicians. If we want people to be more proactive about their health, we need easy ways for them to access it. Across the board, studies show it decreases the utilization of high-cost services and generally leads to better outcomes and feelings of wellness and general good health. So now we're seeing the primary care physician's role unbundle and change to address the shortage. Instead of a primary care doctor office visit, we're seeing new, low-urgency ways for people to get care and better ways to route them to the appropriate place based on what they need. The first step is even knowing you have a problem in the first place, and this is where consumer diagnostics and monitoring tools enabled by mobile phones and cheaper sensors fit in. If anyone's a Star Trek fan, you may know what this is. This is a tricorder, which is the universal diagnostic machine that anyone can use, and it's been the goal of healthcare entrepreneurs, investors, etc. to fund or build this. There's even an X Prize dedicated to this. The reality is a bit harder than that, though. Companies like Scanadu and several others have raised a lot of money on crowdfunding sites too to give you a sense of the consumer demand, but couldn't necessarily pull off their promises. On the monitoring front, it turns out that not all data is equal. Many of the first wave of quantified self companies have floundered, including Fitbit, which was one of the larger successes. It turns out that just throwing sensors on people is not necessarily the solution. People want actionable data. One of the main reasons people buy these wearables is for the accurate data that they can use to manage their health. In order to do that, companies need to prove that the data they have is usable in clinical settings. If clinical grade data is the key, these companies are going to have to go through regulated channels like the FDA. In tandem, we're starting to see regulations shift and opportunities open up because the definition of a medical device is expanding both on the diagnostic and monitoring front. One seemingly small but far-reaching piece of legislation that has recently passed was the Over-the-Counter Hearing Aid Act of 2017. This allows hearing aid makers to skip the physician middleman and sell directly to consumers, and the FDA is creating a track for these lower-risk wearables and tools that create clinical-grade data being sold directly to consumers. So more medical device and wearables companies can be expected to take advantage of something like this. It's not just devices. Regulations are important for diagnostics too. Let's examine two different companies that went up against regulations and measure them with our trends tool to see the media attention. Theranos increasingly attracted more negative attention in the last 2 years after not complying with regulatory bodies, and subsequently has hidden from the press spotlight, though recently there has been a spike since the company raised another $100 million in debt. But 23andMe, on the other hand, faced the FDA, worked with the government, and now has a litany of different medically relevant tests and is attracting more attention. 23andMe effectively helped create the category of medically relevant predictive technologies, with lots of startups now raising money in the direct-to-consumer testing and carrier screening markets. These companies are blurring the line between diagnostic and predictive, and also creating relationships directly with consumers. These new developments suggest we're moving from an era of reactive health to one of proactive health. Today, we mostly wait until we feel sick, find the necessary care after going to see our primary care physician or ending up in urgent care or something worse, and then we give the relevant data for a diagnosis. Tomorrow, the data will come first from medical-grade wearables and diagnostics, and it'll be routed to the correct care option, and they'll have the relevant data and predispositions to your case and take additional data to either prove or figure out what you might have. So this is a total inversion with how patients seek out care today. Apple sees this as an opportunity and is working with the FDA to capture medically relevant data through the watch for common heart conditions. They're also partnering with American Well in this process, and this is a sneak peek to what proactive care might actually look like. And they aren't the only tech company. Google's health subsidiary Verily is also working to create medical-grade data streams through different devices and also finding ways to assess risk to aid in intervention for patients that need it. That's how we help. That's how we help figure out whether patients need to get care. Now, what happens when they know they need it? The next piece I'm going to talk about is retail clinics. If you've walked into a CVS or Walgreens recently, you may notice that more and more of them have walk-in retail clinics. It's becoming more popular across the board. You can go to these retail clinics to get certain tests done, like STDs, vaccinations, develop certain cultures, and other preventive health measures. A big reason for this is the fact that retail clinics are faster. And it's not necessarily that the wait times drop dramatically, but rather the exam time drops significantly because most people that go to a retail clinic know what they need when they go there, and the tests that a retail clinic offers are usually chosen because they're fast to conduct. We're starting to see more companies that are trying to extend the types of care you can get at your local pharmacy. This can be kiosks for telemedicine, more diagnostic tools, but it's also an area that's tough to crack, and we've seen some well-funded shutdowns like HealthSpot. These retail pharmacies are looking at other forms of care too. I use the CB Insights Business Social Graph to map out the investments of Walgreens, CVS, Walmart, and Rite Aid, and we see some interesting activity when it comes to the promotion of care. We have a full analysis of this on our research page, but some highlights. Walgreens has made an investment in TytoCare, which provides the tools for consumers to do tests on themselves, and CVS has invested in My Health Teams, which is a social network for people with chronic disease. Both of these have clear use cases in identifying potential customers, better distribute goods, and importantly, manage the health of people that come into the pharmacy. This is something CVS has been pushing for a long time. They're trying to increase the lifetime value of their customer by giving them more reason to interact with CVS wherever they are, as said by Brian Tilzer, who heads up the CVS Digital Health Division. But extending customer lifetime value is a baby step. As you may have seen, CVS has taken this a step further by acquiring health insurance giant Aetna for a lot of money. Now, instead of finding ways to keep consumers coming back to them, CVS actually becomes a corporation that has to manage the risk and health of their population and participates in the financial upside of doing so. And so, because of this event, we're probably going to see CVS clinics become more of a hub for preventive health services and other retail pharmacies having to respond. And I didn't get a chance to add this, but if you actually look at where CVS clinics have the biggest retail footprint, it's also in areas that have the lowest primary care to person ratio as well. So they can actually really help areas that have access to care and put these clinics in areas people already go for other things. Going further into the brick and mortar shifts in healthcare, urgent care has taken off by providing fast care for non-life-threatening, but I really need to see the doctor now types of situations. And they're really starting to proliferate, especially in cities. I took this snapshot of Google Maps right around the CB Insights office, and there are a lot of urgent care clinics. The data also shows this out. The number of urgent care clinics are creeping up, possibly due to the fact that in general there are more people with insurance, and also an active effort by payers to keep people away from the emergency department unless they absolutely need it. And that's for good reason. I mean, the ED is way more expensive, especially for a lot of these lower risk issues that aren't typically life-threatening. Urgent care hits that sweet spot in between primary care with long waits and the cost of the emergency department. This hole that urgent care has filled has made it a particularly attractive place for private equity investors to get involved, and they've involved in nearly a quarter of urgent care transactions since 2010. One of the notable exits has been CityMD, which is really popular in New York and was acquired for $600 million last year by a private equity firm, Warburg Pincus. So this is an area we're probably going to see more investment in as a whole, and I guess the more money, more company formation. I could talk way more about urgent care, but time is of the essence, so I'm going to shift a little bit and talk about direct primary care / concierge medicine, which is becoming a more attractive primary care option for many. Direct primary care and concierge medicine are different in many ways, but both rely on the concept of retainer fees and smaller patient panels compared to a regular family practice. The table here is just meant to be illustrative of some of the companies we looked at in each bucket and isn't necessarily true of the entire industry, but it demonstrates the point that both DPC and concierge are locking patients in with this retainer fee and also giving them which gives them a more recurring form of revenue and gives patients more time during visits and better access to the doctors either outside of typical hours or just more available appointments. Sometimes the retainer fee includes a lot of the tests you would need, or can give closer to wholesale prices. So these new clinics are trying to build as much as possible from the ground up, with most realizing that relying on third parties can be large detractors of the consumer experience, which is basically what they're selling. So companies like One Medical and Forward have built their own EMRs, apps, have lab testing in-house, and also build tools for their physicians to better manage patients. They're also using employers as a distribution too, pitching a subscription to their clinics as a perk to employers for retention purposes. The issue is that we have yet to see any of these direct primary care models prove to be a scalable investment model. Even One Medical raised its first round more than 10 years ago and still hasn't exited. And companies like Q-Liance, which have raised more than $30 million, or Turntable Health in Las Vegas, have shut down. The reality is that direct primary care and concierge models are dependent on small patient panels, so they're inherently hard to scale while maintaining the same quality of care. We are seeing some companies now that are doing virtual direct primary care, and so in certain ways they can scale that up and reduce costs and also see more people. But there are downsides to that too. For example, sometimes patients want all of their care bundled in one place and don't want to have to go to the testing facilities, which might be part of their hassle and might be a detraction from the consumer experience that they're expecting. And if you remove the brick and mortar completely, which is sort of what these telemedicine DPC models are doing, that might be a way to make a business more scalable, but it also comes with its own set of obstacles, which we'll talk about now in the telemedicine section. The positives of telemedicine are pretty clear. It's a way more accessible form of care for people when they need the care. It can be stored and creates a lot of mineable and usable data like text. Plus, people can refer back to it if they have questions or maybe didn't understand instructions. It's location agnostic, so not only is that important for people that might be far from a traditional primary care physician, but also means that we can add a supply of doctors from across different geographies to balance the demand. And finally, it can be asynchronous, meaning you don't actually have to see the doctor face-to-face in many cases. Just to put some data behind this, you can see what the primary care to patient ratios look like across the map. In a telemedicine world, hopefully this smoothens out the supply and demand curves a little bit. And it's not just primary care, but services like mental health and wellness coaching can extend to some of these areas where the need and impact might actually be higher than cities. Apart from rural areas, one of the higher impacts telehealth can have is with the chronic disease population, which can be managed better by lifestyle modifications and a lot of things that happen outside of hospital visits. This could also be an older and less mobile population as well. Post-surgery is also a high area of interest since the recovery windows and reimbursement are pretty well defined, and usually a pretty simple follow-up to make sure nothing crazy has happened is all that's necessary, and some of these patients might also have the mobility issues we talked about before. But telemedicine is not without its obstacles. Despite all the benefits we've talked about and the technology being available, there are still a lot of complications with operating across state lines, both from a licensing perspective for physicians, but also for reimbursement. States are slowly figuring out price parity laws for telemedicine to be reimbursed like a normal visit. Teladoc is one of the few telemedicine companies. While we're figuring out how reimbursement works and regulations get ironed out, we're seeing less money go into private telemedicine companies too, partly because of the business model problems. But also partly because there haven't really been a lot of exits to return money to investors. Even some of the more well-funded companies like Doctor on Demand and American Well have raised large sums of money and still haven't exited. Teladoc is one of the few companies to enter public markets, but even they struggled for a while before slowly creeping back up in share price. And I think Teladoc is actually a good case study for the obstacles telemedicine companies face. For example, the company keeps ramping up the number of members onto its platform, but utilization is just hitting 5% of their total user base. So even though more people are signed up, the number that actually use it is really small, though it's really impressive that they're growing their user base and their utilization is growing in tandem. That's definitely not an easy feat. At its core, part of Teladoc's issue rests generally in the business models for telemedicine. The three main first waves of telemedicine companies have been per member per month, which Teladoc makes most of its revenue from, and uses employers or payers as a means to give telemedicine access to their employees. There's licensing, which is more of a flat fee for companies to use the telemedicine software. And then there's pay-as-you-use per transaction. The problems with these models is that they're tools to keep a population healthier, but don't reap the financial upside of doing so. They're selling to businesses that see tons of other similar-looking telemedicine companies, and it takes a long time to prove that they actually work. And in many cases, the doctor's visit still takes a long time, and the economics of seeing a doctor haven't really changed. We're starting to see new telemedicine models emerge to maximize the value gained and captured from keeping these populations healthy. One example is telemedicine as a part of coaching programs or digital therapeutics. For companies like Omada Health doing virtual diabetes programs, using telemedicine as a means of scaling the service and doing it remotely is a key part alongside other things like hardware. What's important about this is that these programs are outcomes driven. CMS is looking to reimburse diabetes prevention programs that can prove they work. So these companies that use telemedicine now get money by proving they keep their populations healthy. Virtual programs are still being reviewed to prove efficacy, but it's likely going to be an outcomes-based model as well. Another telemedicine business model is using the asynchronous nature of telemedicine to scale down the cost. With some startups, you fill out a form and a bunch of questions for low-risk medical products like erectile dysfunction treatments, birth control, hair loss, and a doctor can now quickly look through a stack of patients in 30 minutes without seeing them face-to-face. This means the doctor can see 15 to 20 patients in the time of one face-to-face visit, so the cost of service scales down, and now you can see a doctor for $15, $25, and it's more of an out-of-pocket expense, and you don't have to go through the health insurance process. Instead of standalone telemedicine businesses, new insurance companies are putting telemedicine and virtual services at the core of their business. We've seen lots of insurance companies and telemedicine partnerships, but the new tech-centric insurers like Oscar are putting telemedicine right at the front of everything they do and claim a 23% utilization rate compared to the industry average of 5 to 8%. Oscar reaps the financial rewards here by keeping their covered enrollees out of the hospital. Oscar makes money on telemedicine by taking off the health risk of the population they cover. But we're also starting to see hospitals do this too, as more of them become accountable care organizations, and many set up their own provider-sponsored health plans. With hospitals becoming risk bearers themselves, telemedicine is becoming table stakes for them, especially for some of the higher cost populations like Medicare. When you look at why providers want to use telemedicine, it's a combination of wanting to improve the patient experience and getting better outcomes to get paid. And so a new crop of tech startups are targeting hospitals to do things like increase the number of patients a provider can see, get access to specialists when they need them, and managing patients outside of the four walls of the hospital, especially in the chronic disease cohort and Medicare cohort, with hospitals getting reimbursed for taking care of these populations. That brings us to the end of telemedicine. New business models, buyers, and approaches might actually make a bigger impact than the first wave of companies. And now we're in the final section, prescription management. Medication adherence is a huge problem. The drop-off numbers are pretty staggering and is a huge contributor to failure in treatment, medical waste, and can mess up clinical trials. This is from one study, and it's a relatively small cohort size, but I'm just using it to show some of the reasons for lack of adherence that many of you may have heard about, from forgetfulness to not thinking it's worth taking to not liking the side effects. And so now we have a new wave of companies trying to address certain problems that might impact adherence. Some companies are bringing your medicine straight to you and have a concierge to deal with any issues with your insurance eligibility. For some people, just going out to get the medicine is a pain point. Other companies are trying to make the medication regimens as easy as possible to understand, separating pills into daily packets and explaining what each one does. Or if prices and price transparency is an issue, some are either trying to make it easier to shop or find ways to reduce your cost to make it as affordable as possible. Since forgetfulness is one of the big issues with adherence, a wave of companies have raised money to address this issue using sensors, reminders, and different types of hardware. But there's still a question of whether simply sending a reminder alone is enough to get people to take their medication. It might actually take a number of combination of techniques to keep people adherent, which is why many of these hardware companies offer interventional services now. So maybe it might just be more than fancy pill boxes. By the way, this is an actual item from the Tiffany's Everyday Objects collection, which I highly recommend checking out just for the entertainment value alone. The question is open on who's going to lead the adherence charge. One thing we see is that pharmaceutical benefit managers, PBMs, are now facing a squeeze on their existing business and need to find new ways to prove they can save insurers money. Several of them see adherence as one of those ways. Here, we see Express Scripts investing in one of these adherence startups, Mango Health. Recently, they also partnered with a smart asthma inhaler for a similar purpose. Or maybe the people who will take the biggest leap in adherence will be the people who have the financial risk at stake, a theme you've probably noticed has come up a few times. Companies like Clover Health, a new Medicare Advantage insurer, has dedicated a lot of resources to make sure that their customer experience team can intervene if they ever sense there's an issue with not taking meds, because it's in their best interest as well. So here we see a combination of a few tools and a human intervention to keep people on track. I just went through 6 of the ways the consumer interface to healthcare is changing today, but tomorrow it could look even more different. One of the technologies we spend a lot of time looking at is artificial intelligence, and it's one that could potentially really change how people get care. For some context, when we look at where activity is happening in AI in general, it's actually seen most of the activity in healthcare and recently fintech as well. New companies are trying to apply AI to a lot of different parts of the healthcare system, optimizing back office functions, improving drug discovery and diagnostics, but we're also seeing a lot of consumer-facing tools as well. One example actually combines AI and robotics to create more interactive interfaces for monitoring and medication management, and is especially helpful for those in the late stages of neurodegenerative disorders. Chatbots have been in the tech spotlight for a bit, but there's been quite a bit of traction for chatbot companies that can help assess the risk of a patient and guide them to the right care depending on the severity. Healthcare is a really complex back end, but chatbots create a user interface that people are familiar with and lives right in your pocket. And speaking of living in your pocket, we've talked a bit about this before, but with medical grade wearables generating tons of data and computing power in our pockets, AI is an important bridge that can help actually analyze these massive data sets to help lead us to a more proactive care model where providers reach out when they detect we need help. And we're already seeing tech giants who have an edge when it comes to AI tools finding ways to apply this in healthcare. We talked about Apple's health study, but Google's DeepMind division also wants to be able to do this with imaging data, test results, and more. Their algorithms are also getting better. Their deep learning algorithms recently proved they were able to detect diabetic retinopathy as well as human ophthalmologists could. Google is betting that its algorithms will not only be as good as doctors, but that it's going to be used in tests that require very high specificity and it'll actually exceed the ability of doctors. Recently, they patented a new method of conducting an abdominojugular reflex test using computer vision, a cuff, and AI, claiming that it's a test that requires precision and there's a lot of variability between how doctors conduct it, which Google can standardize. They have patents for some other tests too, like concussions, and just today we caught one for detecting organ failure. Google's bet is that its algorithms can actually bring these tests that in the past you may have needed a doctor to conduct into your home. This would change a lot of the ways we handle lifestyle management and diagnostics going forward. So you may have heard that AI is going to replace doctors trope, but more realistically, we might be able to assist and extend the reach of physicians and also bring these tests home to make sure people only see the doctor when it's necessary. There are different approaches to reaching that end goal. Apple is approaching this from a more holistic angle. Instead of trying to tackle one problem at a time, they want to be your personal health record, medical device, and application maker to keep people more proactive about their health by putting it within arm's reach. And when we look at their media trends, their healthcare activity continues to get more activity and coverage. And most recently, there were rumors that they might actually acquire a direct primary care clinic company. So it's possible that Apple actually wants to be your care provider too, with data and AI tools at the core of it. To wrap everything we talked about today up, which I know was a lot and I appreciate you sticking with me, here's what a consumer's health experience might look like in the future, especially thanks to AI. This is just one possibility. Patients will start generating massive amounts of data thanks to clinical grade wearables and diagnostics at home. Chatbots will help clarify whether or not we're at risk when they see an anomaly and route us to a telemedicine provider who can clarify the severity of our conditions and guide us either to care or testing facilities nearby. And so, maybe not today, but tomorrow, who knows? Thanks everyone for bearing with me. If you have any questions, I'll answer a few now with some of the time we have left. Otherwise, feel free to reach out to me on Twitter, email, etc., and I'll try to get back to you as soon as possible. Thanks. So I'm gonna look through some of the questions. What do you see as the impact of the CVS Aetna merger on this landscape? Sort of talked about this a little bit, but really what it's going to be is how it's going to be an interesting case study on how retail pharmacies and clinics play a role in people's everyday health. These are things where stores where people basically go and visit on a more regular basis. So it's possible that having healthcare be right there will lower the friction. And it's going to be a really interesting case study to see what a pharmacy, a PBM, and a health insurer look like when they're all bundled together. How do you see Amazon entering healthcare? What use cases? There are a lot of ways Amazon can go, and there's definitely been a lot of coverage about what they're doing. Their core competency is really using the leverage they've accumulated of all the users on Amazon. So that puts them in a good position to do things like negotiate drug prices. It's most likely that they'll probably get into some form of distribution of medical goods first. So either direct medical supplies to hospitals or other sites. There's a good argument to be made that they might go into cash pay generics, which is definitely in their sweet spot and sort of they won't need to tread too deeply into the healthcare space. But they could also go closer towards the EMR space, since a lot of their competency is also in AWS and sort of handling data, and they poach someone from Box's healthcare team that does that. So there are really a lot of ways they can go, and we have research online that looks a little closer at this. Let's see. How will this impact the traditional pharma industry? Will they be able to transform into new ways of giving care? So one of the themes we sort of looked at recently is how pharma is trying to move a little bit closer to where the consumers actually live. There are a few reasons for driving this. One is some companies are seeing a lot of their existing blockbuster drugs sort of being flooded with generics, and so they're trying to figure out ways to differentiate what is now essentially a commodity drug by offering things like services and a better experience for customers who are taking that drug. So they do have an incentive now to care about, at least in the commodity side of things, to care about how consumers interact with their drugs. And then the other part of this is also digital therapeutics, which are using software to achieve clinical outcomes. I talked a little bit about this with diabetes, but for a lot of these pharma companies, they see digital therapeutics, which is essentially a consumer-facing services company. They're investing, and Roche actually just acquired a company called MySugar doing this. So this is a way closer to consumer play. What is your perspective on how all of this will be paid for? Does this then disadvantage those who can't use a smartphone and other mobile devices? So there are a few parts to this. One is, like I said, with the CVS Aetna thing, it actually relies a little bit more on retail clinics. And also, a lot of these, especially in the Medicaid space or even internationally with telemedicine companies, they actually do focus on SMS based telemedicine for really specific things that might actually require a really expensive readmission. So there are definitely pushes to get a lot of a lot of people who don't have mobile phones or smartphones involved in the healthcare system. And then the other part is also that those populations can be really expensive and might actually be a reason that carriers could subsidize the cost of a health tracking device. So we're already seeing, I think it's Aetna who is trying to distribute the Apple Watch for a subsidized price because they get the benefits of consumers being more active about their health. So we might also see more subsidy programs. Do you think companies can play a role in taking care of their employees' health digitally? We've been seeing this for a few years. Self-insured employers specifically who bear the healthcare costs of their employees are highly incentivized to get solutions that get people more involved with their health. The issue is that it's become a really saturated space at this point, and a lot of the solutions look very similar to one another. So it is definitely a tougher space to crack into now. How do you see blockchain impacting healthcare in the short, mid, and long term? I knew this question was going to come up at some point. So we've obviously seen a lot of blockchain hype and a lot of interest in blockchain happening right now. It's pretty hard to tell exactly what a fully fledged blockchain solution that's actually usable might look like, and I'm a little skeptical that you can go head to head with incumbents simply by using blockchain technology. I will say that a lot of the solutions blockchain solves for are particularly acute in the healthcare space. So things like governance over data, or being able to sort of increase security over patient data and have data sort of flow from place to place. That's actually a very sort of inevitable end place for healthcare where data can sort of move seamlessly and patients govern it. So blockchain is one way that this could be reached. How do implications of cybersecurity affect this push of connected medical technology into the home? I think this is a good question. We saw with a lot of really large-scale hacks last year, and combined that with a lot of technology becoming a little bit more personal, whether that's Alexas in your home, but in healthcare it could be something like an implanted device. The cybersecurity is obviously becoming a way bigger issue. We are seeing the FDA take notice of this, and they have rolled out actually a framework for how cybersecurity should be approached for medical devices, especially considering that software is something that gets updated on a regular basis. So there needs to be a new way of evaluating the efficacy of these medical devices after receiving FDA approval. So they're looking into this, and they've actually rolled out frameworks, so they're definitely cognizant of it. We're also starting to see companies that make it easier for medical device manufacturers to include cybersecurity, sort of heavy cybersecurity protocols into their devices as they're being manufactured, and in some cases post-manufacturing. I'll do a couple more, and then probably gonna run out of time. Let's see. What role will genomics companies play in healthcare consumerism and risk assessment? Sort of talked about this before, but 23andMe sort of pioneered this model of going straight to consumers as a diagnostic company and maintaining that relationship in the long term. So one of the things that's really interesting about them is they have this constant consumer relationship, and so can use that in different ways, whether that's trying to get additional data from the consumers, upsell them into new services, but also it puts them in the position to recruit consumers for things like clinical trials. So there's definitely genomics has been one of the areas where direct to consumer has definitely taken off a little bit more. We're seeing this with carrier screening and things like that too. So in general, I think it makes people a little bit more cognizant of their health as a whole. If you know you're at risk for hypertension, diabetes, you might be a little bit more cognizant of the decisions, your lifestyle decisions you're making going forward. I'll answer two more, and then whatever I don't get to, feel free to tweet at me or email me, and I'll try to get to it as soon as I can. How will these trends affect emerging markets? What trends will be more crucial? There's a lot of really interesting stuff happening outside of the U.S., I would say especially in China, where a lot of there isn't necessarily as much sort of IT infrastructure that needs to be competed with, dealt with. So there's some sort of leapfrogging already happening, especially because a lot of these sort of countries are already mobile first, and all the data about a person is sort of already located in one central place in the mobile phone. So I think telemedicine in particular is going to see some really interesting business models and use cases in emerging markets, largely also because there's a serious rural to urban healthcare services discrepancy in a lot of these places, and the patient to doctor ratios are extremely low because there's simply just not enough doctors for the exploding populations of a lot of these places. So I actually think that we'll see a lot more incentives from a government level, and also from adoption from people who have telemedicine as really their only way of getting care. All right, I'll do one more question. Where do you see startups being more disruptive within healthcare instead of just making the existing system more efficient? So one of the themes we've sort of seen is that companies are now approaching a full stack sort of approach to the problems that they're trying to tackle, as opposed to just being sort of another middle layer of software. And for these companies, they can actually start really as tech companies at their core that address the full value chain of some healthcare problem. So that can be a completely mobile, full stack clinical research organization doing clinical trials. That can be someone like Oscar, who's a full stack carrier. They actually started as a software layer, but became a full stack carrier because they wanted to capture the value that the tech was actually making more efficient, and they couldn't really do that by operating within the existing system. That could be a full stack primary care, virtual primary care company. So really a lot of the new startups who are able to raise a lot of money, which is really one of the biggest constraints because they're very expensive to start and scale, is creating a full stack company with technology really at its core, as opposed to sort of attacking on tool that you sort of alluded to. So that's all the time I have right now. If I haven't gotten to your question, send me an email, or I'll try to answer these as many as possible. Thanks.